So I know we kind of previously kind of talked about our education experiences and how that kind of impacts us as therapists. And I was just thinking about how, you know, I I, I constantly kind of like praise my program. I think I went to like an amazing program when it comes to, preparing us to work in mental health and really kind of see a diverse group of people. And even though like I think about my like the professors, that wasn't very culturally diverse. But like when I think about like the students and the people that I went to school with, it was. And so I can like count, I would say maybe like 1/4 of the people like within my class were like white people, and then everybody else was of color. And so I think it kind of really impacted like how we approach subjects and talked about things. And it set us up to be in a very more like a, it set us up to be more culturally competent outside of our own cultures because we had an array of different cultures to kind of talk about and bounce things off, and so many different like lived experiences that really got me like ready to be in that setting. I also think that I was very fortunate, just like in the area that I grew up in. It was just like a melting pot of cultures, and people are always like, "How do you know this? How do you know that?" And it's like those were my friends. Those are people that I grew up with, houses that I went over to, foods that I ate growing up. And so I was always kind of exposed to so many different cultures that when I'm working with clients, I'm like, "Oh yeah, yeah, I've heard of that." Now, of course, I never just assume I know everything about their culture, but it's like at least I have like a foundation to kind of make it more um, a more an inviting place for them to be in.
Yeah, for sure. Yeah, I mean, representation is like so important. And you talking about just childhood, I feel like my childhood and like the school I went to, it was mostly Caucasian and there really wasn't that much diversity. And even when I went into my master's program, is located in Kentucky. So it was very much so like Christian, Bible Belt, very Caucasian. All of my professors were mostly white. Most of the students were white. So there was a lack of representation there. Now I do feel like the university tried to, focus on cultural competency, but I feel like that's only one aspect of it if you're not really having that representation. Because then when you're in class and they're talking about certain subject matters, it was like awkward moments where people would look at me and I'm thinking like I'm not the representative of culture.
You're the expert.
Yeah, I'm not the expert. Like we're all learning about, culture competency. So I think that, getting more therapists of culture, I think that that's so important. Not just the CEUs or the continuing education classes, because I think that that's only one aspect of cultural competency. Like we need like more representation so we can have these hard, conversations and educate people. Because I remember in school also, I'm not sure about you, but a lot of the assessments, I remember my professor saying the assessments were all based off of middle-aged white men.
Hmm.
Those are the assessments that they're giving to clients, and I just thought that that was so interesting, and I was just like, that doesn't, scream cultural competency at all.
Yeah, and that's why I have seen that there's efforts to, hire more people of color to participate in the development of these assessments. Um, but like, yeah, I don't use them because I feel like they're stupid, and they do. It's only they're very much. I think that they're stupid, and I feel like that the questions do not apply to enough people. And so when we think about, terms like generalization and things like that, and it's like, can you generalize this to the entire population? And when it's based on, your subject pool is white males, middle-aged white males, then no, you can't generalize this. And so that's one of the words I do remember from research is generalization. And most of the studies, all the assessments, those types of things, our theories that we use are based on things that can't be generalized to every population. It reminds me of when I was in university. that sounds so funny, when I was in university. When I was in college, um, we had the opportunity, like as psych students, to be able to kind of participate in like assessments. And so like the doctoral students would need to be able to practice on people. And so they were like, oh, go let them practice on you and you can get extra credit and things like that. And so I would go down there when I was bored, I didn't have anything else to do. But also it gave me kind of extra credit points and kind of an inside look at how these assessments are done. And so I remember going to one, and it was asking me, it was like an intelligence assessment, and all these questions that it was going through, it was asking things that were very particular to to a certain demographic. And the one that I always remember is um, it was about asking about like Marie Callender. I don't know if it was asking like who it is or what is it about or something like that. But I was like, I know that name. But in my head, I didn't have like the words, or I couldn't kind of come to like, who is this person? But I was like, I know I had seen it before. And it wasn't until like years later that I kind of thought about that. And I was like, that was such a very like culturally specific kind of question to kind of ask. And so many people would have gotten that wrong just because they hadn't had exposure to it. It doesn't mean that they lacked intelligence. But that also reminds me of, I remember taking the GRE. And it was, I always remember this story because one of the questions, and I don't remember much about the GRE, but I do remember this one question, and it was asking about like the makeup of concrete, like what ingredients like make up concrete. And I knew the answer. And you want to know how I knew the answer? Because I watched HGTV all the time. And so they would do like home constructions and things like that. And they were talking about it. And so I just happened to remember that one episode of whatever show it was. And I was like, I know this answer. But it's like, who else would know that answer? Why would we know that answer?
Yeah, for sure. I feel like with the lack of representation in a lot of these assessments being based off of white men, it kind of can create this narrative of like colorblind therapy. Like I don't see color, and that's actually not a good thing, you know, because then we're trying to apply CBT to someone, and I'm wondering like you know maybe there's a way that we can like decolonize some of these assessments or some of these tools to where we're able to kind of cater them to more culture because you know using that colorblind therapy can it can cause a lot of harm with the therapeutic relationship or just make the client feel like they're not connected or like this person doesn't know me.
Yeah, I've always hated that word, and people think it's such a great word of, oh, I'm colorblind. No, that means that you don't see my experience, you don't see my struggles, you don't have an understanding of that, the fact that my skin color is different, or my gender is different, or whatever. You don't see that and recognize that I've had different lived experiences because of that. So you invalidate so much of my experiences by being colorblind.
Yeah. And I'm wondering with the lack of representation, like with these white therapists, like if they struggle to lean into cultural identity, is that something that they kind of stray away from? Do they feel comfortable with asking those questions? Because if you don't have certain life experiences, then how are you going to feel comfortable exploring and talking about, you know, someone's culture?
Mhm. And that's why you see a lot of times that people of color will look for somebody else of color to be their therapist, but it's not enough of us. And it's because they don't want to be constantly like explaining or being misunderstood. And even of course with somebody of color, you may have to do some explaining because everybody's lived experience is different. But it's a place of they want to be comfortable to be able to have these conversations and not feel like it's an educational experience of like, now I have to educate this person, on what I'm going through or what the story is for them to really understand me as a person versus another person of color who already have like a gist of like what they're talking about.
Yeah, because with them having to stop and explain things, it really takes them away from like what they actually want to focus on in that moment. And
Mhm.
I'm wondering if it brings up feelings of like judgment or what is this person thinking about me? I'm trying to explain this one specific thing. Like, for example, like I wash my hair every 2 weeks. And then the therapist is like, well, why do you do that every 2 weeks? And,
Mhm.
then it goes down this rabbit hole. And it's like, then it's like you lose sight of what the client actually wants to discuss.
Yeah. It always makes me think about like you'll have like in the mini mental health assessment and it'll ask about like appearance. And it's so funny because so many of my clients come to me like after work and they just got home and they may have like, put their bonnet on, have their bathrobe on, you know, just took off all their makeup and they may be looking a little bit disheveled. But I was like, they're not disheveled. They just got home. But it's always like, how do you make these determinations of like, is this person just waking up from a nap or are they disheveled?
Exactly, because you could like misread or misobserve somebody by looking at someone, especially if you're not aware of their culture or if they just got off of work and they're just having a human moment.
Mhm.
That's another thing that comes up a lot in sessions. How can a client present a session? Can they wear their bonnet? Like, can they undo their hair while they're in session? And I think with having a therapist that looks like you, it's helpful because you're gonna understand if you see someone taking their braids out. Like, you could take your braids out like during the therapy session. So I think just that cultural piece and that understanding is so helpful with like bridging that gap, and we can really focus on the things that the client wants to focus on.
Yeah. It's funny because I've seen that before with clients, and it's like, "Oh, you missed one," and I call them like, "Yeah," because I'm seeing what they can't see. And I was like, "You missed one," and so just creating that comfortable environment, that welcoming environment for clients, and I think that it makes me think about some of the. I'll be like in some of the therapist Facebook groups, and you'll hear people say, we do a lot of like, in search of a therapist who's this, and this. And some people will be like, well, why does it matter, if they're Black? Why does it matter their political background? Why does it matter this? And it's like, why are you even asking this question? Why do
Yeah.
you not understand why it matters?
Mhm.
And like, it matters so much to the people who, are sitting across from you and how you interact with them. Just because you went to school and you're a therapist does not mean that you can work with everybody. Everybody is not your population of people.
For sure, for sure. Because I think about cultural competency and I think people just think about the continuing education classes, but I think it starts day one when you are meeting your professors, when you're hearing about their theories, when you're with your peers as a new therapist, when you're doing your internship. Like, I feel like it's long before you even actually see a client that you're kind of creating these like subconscious thoughts about cultural competency because this is a word that we hear a lot in school. And once you actually start seeing clients, I think that kind of goes out the window at that point, and it's up to the individual therapist to, make that a priority in their therapeutic toolbox.
Mhm. And it makes me think about also one of the things my practice tends to attract a lot of the LGBTQ plus population, and I'm always like thinking about like which therapists can I pair, with this population. And there's sometimes like when I'm talking to the therapist, they'll say one thing, and I'm like, you don't understand this population. I'm never sending anybody, to you with them just because I don't want you to do harm. And so I think it's also important for a lot of therapists will say, like, "Well, I work with that population." Do you really? Like, do you really understand? Do you understand the language? Do you understand how they talk? Do you understand, the dynamics of this population? And if you don't, there's sometimes it's like I understand enough that I can learn a little bit more and be okay, but sometimes you're so far gone from understanding the population that you need to be able to refer out and be like, oh no, I don't know enough about this. It makes me think about when I have like some of my therapists and they may have a couple who's polyamorous. I'm like, refer out. I was like, you don't have the skill set, and I already know that you don't have the skill set, to work with this population.
Yeah, because I think sometimes some therapists they'll see it as either an offense or a challenge. Like, what do you mean? Like, I'm understanding, I'm empathetic. And it's like, yes, you may be understanding and empathetic, but your reach to meet that client that is a different culture is so far that there's a lot of barriers in between you and that person.
Mhm,
And I think for some therapists, that can be a lot. Like, it takes a lot of self reflection, and maybe they feel like, well, is it me? And it's like, to a certain extent, it is you, but there are other populations that you can work with, so you're not creating harm in those other populations. And I think sometimes it just takes self reflection on the therapist's part.
mhm. Yeah, and I've heard horror stories of clients coming from other therapists and like some of the things that they were saying, especially when it's like they went to like a religious counselor or just somebody who was very kind of conservative in their views and things like that. And they did so much harm to the clients and they thought that they were in a position of like, oh, I'm helping or I'm like guiding them. It's like, no, you're forcing your opinions on them.
Exactly, like that bias that's in the room. A lot of times with people, they can sense with their intuition whether someone's being genuine or they're not. And if you have certain biases or certain underlining beliefs, it is definitely going to show up in your session if you're not aware of those things, especially if you have a client that isn't like the type of culture or that y'all identify like similar.
Yeah, and we've talked about it before in talking about biases, and I think a lot of people know. I have accepted the term, even though I don't think it's 100% accurate. But I've been called a man hater, and so one of the things when I'm talking to clients about like, oh, whether or not you should stay in this marriage or in this relationship, I have to always check myself. Of am I are the things that I'm saying because I feel like men are crap, or are the things I'm saying like appropriate to the situation. And so sometimes I'll say something, but then I'll follow it up with like, but don't listen to me. I'm petty and I'm a man hater. And they find it funny. And they also are able to kind of look at what I'm saying with a grain of salt versus just like it being law because the therapist said it.
And I love you kind of like check the temperature a bit when you are like kind of asking those questions to the client, because it's still very open ended and you're giving them an opportunity to provide you with feedback, versus if it was like a bias, they would probably feel judged or feel like, oh my gosh, like I guess I have to feel like this about the situation.
Mm-hmm. Yeah. And I've seen that. I've seen it with some clients where I may not have delivered or said whatever I said I needed to say appropriately. And because it wasn't in alignment with like what they wanted to do, they would just disappear and never come back. And we
Mhm.
lose so many therapists can lose clients because the way that they may have phrased something and the client not filling in a space to be able to kind of call out the therapist or to say like, no, that's not quite what I'm feeling in those situations. And so being able to kind of also be aware of how you're approaching things, how you're saying things, to these clients based on cultural, religious, spiritual, aspects.
Yeah. And I think that's what checking in with the client is so important, or even clarifying, hey, am I hearing you correctly? Is this the route you were going? Or was, just asking those clarifying questions so we're not assuming, or we're not letting like any biases kind of sneak through.
Mhm. Yeah, because I also think about like different like people who come from like different religious groups, and they'll come in, they'll be really anxious about something, and I'm sitting here like, "Why are you anxious about this? Just leave, or just do this or just do that." But then it's like, hold on, tell me a little bit more about like the environment you were raised in. Tell me more about your family's, relationships with each other, how your parents' marriage was, or how you were raised. So I know, like, oh, we're looking at it from this context, and that's why it's creating all this anxiety. Because me, I'm like, just leave. But for them, it's like, I can't just leave.
Yeah, like there's so many like different layers to things. You don't know if you're dealing with a matter of, is it safe for them to leave, or what is their capacity? What is their bandwidth? What about their family's capacity? So I think when it comes to a lot of cultural things, even though we may identify or even be the same culture, or a different religion or the same religion, it's like we still have to treat each of those clients like a blank slate. Like, okay, tell me about the hierarchy, tell me about the rules, tell me about the cultural norms that you experience in your families. Like, what are the rules like in your household when you were growing up? Because those are the things that are going to influence the client. And if we miss out on those, we're going to be so disconnected from the client. They're going to feel like, oh, she's just not hearing me.
Hmm. Yeah. Because it makes me think about times that I've worked with like interns who may not have had enough experience or exposure to different cultures, and they're like, I just don't understand what's going on. And I was like, have you looked at the like? I was like, what culture are they from? What's their religious background? And then they would tell me, and I was like, oh, well, there's the problem. I was like, within this culture, they're expected to do X, Y, and Z. From my understanding, it's like, oh, really? I was like, yeah, ask them about that. And it kind of opened up so many more doors for them working with that client because they were able to like, oh, there's a cultural element to this that I'm missing, and I didn't even realize that I was missing it.
Hmm. Yeah. And I think just being curious is very helpful too, because if you kind of go into a situation checking off boxes, oh, this is their culture, they're going to fit in this box, like we could be completely wrong. So checking in with yourself, staying curious, I think is like the best thing that you can do, because those cultural competency CEUs, because I recently just took some. I mean,
Mhm.
it's literally just the tip of the iceberg. There's so many other things that I think you truly only learn through like lived experiences. I don't think it's anything that anyone can teach you.
Yeah, and it's funny because you say like be curious, and I always say that too. But for me in particular, I always say I'm just nosy. And I like to learn so much stuff. And I'm like, oh, what do y'all do? And what do you eat? And what is that like? And can you do this? And can you do that? And so it's not like I'm just sitting here grilling a client, but I'm throwing it into the conversation so I can get more information. But also I just want to know. I want to know what it's like. And I store it into my own little database of, oh, this culture also does this. And so I kind of keep it in mind for when I'm working with other people of that culture.
Yeah. And then on top of that, sometimes you have a combination of cultures. And
Mhm.
then it's like it's really interesting at that point, because are you learning more of your things from mom's side or dad's side? So, and then it could be a fusion of things, and then you're dealing with this whole new cultural identity that you've never experienced. So I feel like it's so layered, and it's truly just based off of that person's experience.
Yeah, because I also think about people who were, you know, raised in a certain way within like a certain religious group or within a certain cultural like surrounding, and then they moved to something completely different and like took on that stuff. And it's like that stuff still impacted them. That past stuff is still impacting them, even if you're seeing them in this setting now. And it's like, I'm like, I don't quite understand why they're this way because they still have those thought patterns from that previous section. And so, yeah, even like the changing of cultures, the mixing of cultures, all of it plays such an important role in who this person is as an individual. And that's why, as like therapists, it's why I always say like you can't force anybody into like one theory or one box because everybody is so unique and so complex, and they have all these different like lived experiences.
Yeah, for sure, for sure. Because you could be talking to someone and they're like, "I hate my birthday," or "I hate holidays," and you're thinking one thing, and come to find out, and the client is really like Jehovah Witness. So it's like
Mhm.
if we're missing certain pieces like that, that's going to change the whole context of why someone might hate holidays. Um, so it's really a unique case for anyone, and I think even culturally, when your cultures match and you know a lot of information, I think you still have to be very curious and ask that person about their experiences, because it could be completely different.
Mhm. Yeah. And going back to like what you were saying about like the continuing education classes, I was like, those are a big joke when
Yeah.
it comes to like teaching about culture, especially when they're coming from groups of people who are not part of the culture that the CEU may be like instructing or talking about. And I'm like, I'm always like, what do you know? And so you can study and study and study, but until you have like really put yourself into that culture and that lived experience and talked to these people and worked with these people, you don't have the same level of understanding. And so reading a book isn't going to get you to that level of understanding. Taking a course isn't going to get you to that level of understanding. You really have to immerse yourself in in different cultural experiences and being just open to different things. It makes me think about, I've been having conversations lately with a lot of my clients, and it's about like trying new things. And one of the things I've been joking about is like, how do we cook our steaks? And I was like, I eat steaks medium rare. And so many people like of the Black community is like, well done. You don't eat if it has any blood in it, if it's red, it's not done, you're gonna get sick. And so I was like, I want to challenge you to kind of step outside of that box of what you have been programmed to believe, to take beautiful flavor of a medium rare steak.
Yeah, for sure. Because it's definitely a difference. I was thinking about what you said earlier. Like your level of understanding is going to impact your level of empathy too.
Mhm,
So that could also create a barrier to where one therapist with a certain client, it may be difficult for them to provide that empathy if they're not really understanding. Because when I used to work at an IOP, I noticed a lot of the white therapists, and they would have a client of a different culture, they would be so confused. They'd be like, I'm not understanding. And I'm thinking, like, how is this going to be translating in your session if you're so confused? Like,
mhm.
how are you able to truly hold space and be present if you're confused?
Yeah.
Yeah.
It makes me, I always think about this one client in particular, which I'm not going to give the whole story of, but it was very much of a, they were telling me about their experience, and one of the things I, in my response, it was very much of, I'm sorry. And they was like, thank you. And they had told me that like previous therapists would try to like rationalize or change the way that they were thinking. And I was able to recognize that this is one of those situations that the systems around us have created, and it's factual for us, it's factual for our lived experiences. And so I was just able to kind of hold that space and like, I'm sorry that you're going through this.
Mm.
I can't change the systems.
Yeah, and that was such a beautiful moment for the client to feel seen. And I feel like with culture, it's one of those things where it's an opportunity to make someone feel seen, but it's also an opportunity to make someone feel alienated.
Mhm.
So I feel like it can go either way.
Yeah. I also think about like even you know, in here in Houston in particular, there's a high like population of people from like all over the country that kind of come in. And what I see also is even clients from different like regions of the country has like have different experiences. And so I think about some of like my northeastern who may come off more aggressive. And so I have to think about like they're like, I don't know what's going on in this interaction. And I'm like thinking because of the regional differences, people are seeing you as being aggressive. You're a little bit too much for what we do down here in the South. And so just being able to kind of understand like the different regions. Recently I've been learning about like Pacific Northwest, and that's a completely different like demographic of people than what we have down here in the South. And so I have to think about those like cultural elements too, is like where are these people from? What are their lived experience based even on their region in which they live?
Yeah, that comes up a lot for me in sessions a lot too, especially if you're speaking to someone that's, say, from New York and they're trying to understand the culture of the South. It's like, what is that about? What about yes, ma'am, and no, ma'am? And I don't understand like the culture of drinking in different places. Some people drink very socially, and in other places they don't. So it's not only about like your skin color and your experiences with your immediate family. There's so many things that culture is affected by, even like
Mm,
the way that you eat. So
yeah. And so I think it's important as therapists to kind of constantly be in a place of learning and being curious and taking in as much information as possible. And that may mean also like diversifying, the circle in which that you operate in. And it's like, what does your friendship group look like? What does your, workspace look like? What is the places that you put yourself in? are you putting yourself in situations where you can understand or be exposed to, different cultures, different languages, different foods, different experiences, so that you have a better understanding of the people that you're working with.